This video might just save your life. I don't mean to be melodramatic, but we really need to talk about syphilis. Syphilis is a sexually transmitted infection, once thought to be rare, but cases of syphilis are on the rise. This resurgence in syphilis is tragic because it is a contagious, sexually transmitted illness, and it can be very deadly. One of the problems with syphilis is that the signs and symptoms of syphilis look like the signs and symptoms of so many health problems that it's easy to miss the diagnosis if you don't think about it. One of the other reasons why this is so tragic is because we'd almost gotten rid of syphilis here in the US at one point. As a matter of fact, back in the day, a long time ago, when I was a medical student, while I was taught extensively about the signs, symptoms, treatment, etc. of syphilis, I was also taught, you're probably not gonna see this. Just keep it in the back of your mind, it's super rare. Fun fact though, as a historical aside, dermatology as a specialty probably would not exist if it were not for syphilis. Forget about Botox, forget about filler, forget about acne. Dermatologists originally were known as syphilologists because that is what lended us credibility in medicine as a true medical specialty, because syphilis can be discovered, diagnosed from skin exams, skin findings, and we really were booming in our heyday back in the 1800s. How do you get syphilis? Well, you get it from having sex. Oral sex, anal sex, vaginal sex. And a pregnant woman with syphilis will pass it to the fetus, and that is tragic because it causes severe birth defects, and in most cases, sadly, the fetus is born dead, stillborn. Syphilis is contagious, and again, you get it from having sex. Syphilis requires a human body in order to live and exist. So you cannot get it from a toilet seat. You can't get it from sheets, from tables, from sitting in a chair that someone with syphilis sat in. The good thing about syphilis, if you're someone who likes to look on the bright side, is that it's actually pretty easy to diagnose, and it's also easy to treat with the right antibiotic. It can be cured. The earliest warning signs of syphilis often appear on the skin. Why is syphilis on the rise? There are actually many underlying reasons for the increase in syphilis. A big reason is actually just overall a decline in awareness. Up until this most recent resurgence in syphilis, if you think, I don't know, 10, 15 years ago, it was not really something that was discussed that often, not really on everyone's mind. One of the reasons this resurgence is so tragic is that it's really just demonstrates that we've been too slack, because in the 90s, in the US at least, we had nearly eradicated syphilis, because at that time there was a lot of money being funneled into public health awareness around sexually transmitted infections. You would see more at that time, billboards and things encouraging people to get checked for syphilis. While it's easy to diagnose syphilis, it's also very easy to miss syphilis, because the signs and symptoms of early stage syphilis, which we'll go over in a moment, they are transient, meaning they appear and then they go away. And they are usually without any symptoms, painless. The skin, while it can be a window into what is going on internally, it's only a window if you are looking at it. Most people are not examining every nook and cranny, every skin surface with a mirror every single day. So if it's popped up where you can't see and it's painless, you may not even know it's there. Those early signs and symptoms, they usually go away within about 3 to 6 weeks. But even at that point, when the symptoms and signs that you may have missed go away, you are still contagious. So people don't realize they have it because they miss the signs, and they go out and maybe have sex with someone, spread it to that person. That person then spreads it to someone else if they have sex with somebody else. Even when you don't see the signs and symptoms of syphilis, even when they have gone away, resolved, you still are infected and you are still contagious, so you still can spread it around. Another reason for the increase in syphilis is the fact that people struggle with access to healthcare. Diagnosing syphilis and getting treatment is essential for getting rid of it. But if you're unable to access healthcare in a timely fashion, you can imagine how it's a lot more likely that this diagnosis is going to go missed. For example, if the signs and symptoms appear and you actually notice them, but you are unable to get in to see a healthcare provider, and you struggle to find somebody that is in your network or that you can afford, all of these different access issues, Then the signs and symptoms go away, and you probably think in your mind, oh, that must have been nothing, it's gone, and you move on with your life. But you're still infectious, you can still spread it, and the syphilis does not go away, and it will cause more health problems for you down the road. I don't care who you are, you need to understand that testing for syphilis can find it early and save lives. Doctors are encouraged, especially in the wake of the increased cases, to have a very low threshold for testing for syphilis. Syphilis, like I said, it is the great imitator. But as a patient, the mention of syphilis might catch you off guard, might make you a little uncomfortable, like, why do they think I have syphilis? If you are the parent or a caregiver of a child, a teen, a tween, and you find out that their doctor wants to test them for syphilis, you may not like the sound of that. Oh no, not my child with a sexually transmitted infection. Listen, you want your doctor testing for syphilis. It doesn't matter who you are, what you do in your life. Syphilis is on the rise. Testing for syphilis is good medicine. Please do not get offended if you see that your doctor wants to test for syphilis. Like I said, it's the great imitator. If you get tested for syphilis and it's negative, then you can rest assured that it's not that, and your doctor can go about making an accurate diagnosis. I'll give you an example. In dermatology, a skin condition that we see all of the time, a lot of. I even have a whole dedicated video on it. It's called pityriasis rosea. It's a rash that appears, it's temporary, it goes away, but it looks eerily similar to syphilis. Checking for syphilis is a good thing to do. Even if you don't suspect it, the history doesn't support it, person may have never had sex in their life, still check for it, because missing syphilis is not anything anybody wants on their clock. And importantly, if the test shows that you have syphilis, well, you can get treated and it can be cured. Not only is that good for you, prevent the spread of it to other organ systems, but it's also good because you're not going to then be spreading it to other people. What are some clues, signs, symptoms that you have syphilis? All right, what you need to understand is that syphilis, it moves through your body in different stages. The first stage is called primary syphilis. Most people will develop symptoms of primary syphilis within 3 weeks of having sex with somebody who has syphilis. The telltale clue of primary syphilis is a skin ulcer. You can have one or more of them, and they are painless. These ulcers are called a chancre. They can appear on your mouth, in your genitals, your vagina, and your anus. The canker usually goes away on its own, heals up completely with no sign that it was ever there in about 3 to 6 weeks. So again, this is something that you could easily miss. That sore is contagious, and once the sore heals up and goes away, you are still contagious. At this stage, not only can you spread it to other people by having sex, vaginal, anal, oral, but you can also spread it to other people through kissing if you have like a sore in your mouth. If primary syphilis goes untreated, the syphilis can then spread to other organs in your body. If you are not treated, you can go on to develop what's called secondary syphilis, the next stage. With secondary syphilis, the disease is now spreading to other organs in your body. So again, you get a rash. Now the rash of secondary syphilis, it can take on many different appearances, and again, it is the great imitator, so it will look an awful lot like many other skin conditions, skin problems. Classically, the rash of secondary syphilis will involve the development of these coin-shaped spots on the palms and soles, but not everybody follows that textbook pattern. With secondary syphilis, you also can develop sores on any sort of moist surface, mouth, genitals, nose. With secondary syphilis, you're likely to have a lot more symptoms, feel ill in comparison to primary syphilis. It's not uncommon for people to have a fever, sore throat, swollen lymph nodes. You can experience fatigue, weakness, weight loss, and you also can develop hair loss. At this point, if the syphilis spreads to the nervous system, it's not uncommon to have like a stiff neck, a really bad headache. You can develop hearing loss, problems with balance. You can also have problems with your reflexes, and you can even develop paralysis with secondary syphilis. Secondary syphilis lasts weeks to months, and then these symptoms go away. They go away for the most part. Some things may be permanently altered, but a lot of the signs and symptoms will just completely resolve. So again, if you have not been treated and this goes away, you may have thought, gosh, I had this really bad flu, but I guess it was nothing, and you go on. And again, all the while you are still infectious. So if you continue to have sex, remember, you're contagious, so you're spreading it to other people. Just like with primary syphilis, you can spread secondary syphilis by kissing if you have like an ulcer in your mouth, or if you kiss an ulcer. While most of the signs and symptoms of secondary syphilis go away, that does not mean that the syphilis has gone away. You still need treatment, and treatment is essential to prevent you from getting more serious disease and from spreading it to other people. Without treatment, syphilis will progress to the next stage. The next stage is called a latent infection. And a latent infection, basically the syphilis is living within you, but in contrast to the other stages, you're not really going to have any obvious signs, symptoms. You're going to go about your life and you're going to feel just fine. This is called the hidden stage. Without treatment, you can have latent syphilis for most of your life. You also can relapse from latent syphilis to go back and have the symptoms of secondary syphilis all over again. You can have about 2 to 3 relapses of secondary syphilis from the latent syphilis. Each time the secondary stage ends, you will go into latent infection again. Then there is another stage that can come. This is the one that's most severe, tertiary syphilis. Tertiary syphilis involves destruction of organs. It's called the destructive stage. What you get are these really, really deep sores that are called gummas, kind of an odd name. So gummas are these really deep sores that destroy whatever they are on, whether it be your lungs, your bones, your skin. At this stage, the syphilis can take over your central nervous system, your spinal cord, your nerves, your brain. It's called neurosyphilis. It also can take over your heart, your blood vessels. That's called cardiovascular syphilis. Cause, all sorts of heart and blood vessel problems, disease, quite serious. Tertiary syphilis is so destructive, untreated, it can cause you to die. I mean, it can cause death. Tertiary syphilis can take years and years and years to develop from latent syphilis, but importantly, even at this stage, treatment can still help. Treatment can help stop it from spreading, from causing severe disease. However, at this stage, tertiary syphilis treatment, unfortunately, is not going to undo the damage that it has caused. Who gets syphilis? Anyone can get syphilis. There are certain risk factors, though, that make you at an even greater risk of getting syphilis. Having unprotected sex with multiple partners definitely increases your risk. Again, syphilis, easy to miss, easy to not realize you have it. Having unprotected sex will spread it to someone else, and therefore that is a greater risk than not having multiple unprotected sexual partners. Men who have sex with men are at a greater risk for syphilis. And having a sexual partner who tests positive for syphilis makes you at greater risk for developing syphilis. Being HIV positive is also a risk factor. Now, one thing I want to point out, if you have HIV and you are taking antiretroviral medicines, they will not protect you from syphilis. You are still at an increased risk of syphilis even when you are taking medication to treat your HIV. Those medications help slow down the HIV, but they don't protect you from syphilis. They don't lower your risk of getting syphilis. How can someone lower their risk of getting syphilis? Well, it is a sexually transmitted infection, so not having sex, oral, anal, or vaginal sex, obviously will decrease your risk. But if you do choose to have sex, protected sex with condoms and dental dams can help cut down on your risk of syphilis. Why am I making this video? Well, again, our namesake in dermatology is we're really syphilologists. I know you guys think it's all Botox and fillers, but no. This is like actually our bread and butter and what like the specialty was born to do. Diagnose, treat, and educate about syphilis. It is on the rise, and a lot of people are not aware of it. And increasing awareness is key to get a hold of this current increase in outbreaks of syphilis. I think that's really where we have gone wrong as a society, is we kind of slacked a little bit on educating the public about syphilis as a disease, and we're seeing it on the rise. That coupled with other things which I mentioned at the beginning of the video. Last but not least, if you have been diagnosed with syphilis, these 5 things you need to know. These 5 things are essential. Number 1, if you are diagnosed with syphilis, get treated. The right treatment can cure the syphilis. Untreated, the syphilis will spread to other organs throughout your body, and untreated, you can infect other people when you have sex. Number 2 is also very critical. You have to tell your partners. You have to notify your partners that you have syphilis because they need to be tested and treated because there's a high likelihood that they may have it. Now, that being said, sometimes it's not always a safe thing to reach out to a partner, all right? I understand that as well. Talk to your doctor. Local healthcare authorities can actually intervene and communicate to your partner. So talk to your doctor and work with your local health department. They can intervene. Syphilis is a condition that healthcare providers are required to report diagnoses of to public health to keep track. So those public health agencies, they can also work with you to inform your partners so that you don't necessarily have to. Number 3, you have to stop having sex for at least 1 week and until you have completed treatment and all of the signs and symptoms have gone away. Number 4, make sure when you are able to have sex again that you're using condoms and dental dams to reduce the risk of sexually transmitted infections. And number 5 is super important. Make sure you keep your appointments with your doctors. This is another reason that I think contributes to the overall rise in syphilis cases. Again, getting back to that access issue. When you get a diagnosis of syphilis and you are given treatment, you have to follow up with your doctor because they need to do tests to make sure that the syphilis has been cured, that you no longer test positive. That's really important. Sometimes people need an additional course of treatment before they clear out the infection. So you got to follow up with your doctor. All right, guys, that's what I wanted to say about syphilis. I really hope this video was informative, helps with awareness, because it's not the most fun thing to hear about, I'm sure. So I really appreciate you guys watching, especially to the end. It really helps the video out, get this message out there. On my channel, I have a variety of different skincare topics that we cover, anywhere ranging from the gamut of tips to get glowy skin all the way to syphilis, trying to cover all of the dermatologic bases for you guys. So I really hope you guys enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.